We're going to discuss the theoretical person for a minute. This person's name is going to be Jimmy. Jimmy loves spending time with his friends and family. He loves going fishing, playing sports. He's also a really good student. He works hard in school and he makes good grades. Recently, however, Jimmy really hasn't felt like doing any of these things. He hasn't cared to be around people. He's been spending most of his free time in his room. He's been sleeping a lot more, eating a lot less. He's also having trouble with school and he's having difficulty concentrating. Someone might notice this in a person and wonder what in the world could be having such a profound effect in a person's life. And the answer to that is a brain disorder called depression. You may have had depression yourself. You probably know someone that has experienced it. And the fact that it is so common and can have such a significant impact on a person's quality of life is a reason that a lot of effort has gone into better understanding this disorder. So researchers, of course, firstly ask, what is the cause of this? What causes a person to develop depression? And it is known that a hormone called serotonin plays some role in mood regulation and also in the development of depression. One study published in Science named Influence of Life Stress on Depression, Moderation by Polymorphism in the 5-HTT gene suggests that some people have a genetic disposition for developing the disorder. Researchers found in this study that a polymorphism in the promoter region of the serotonin transporter gene determines the amount of serotonin transporters present in an individual's brain. People with more of these transporters were found to be more resistant to depression, while people with less of these transporters were found to be more susceptible to depression. To illustrate this, I want to show on my whiteboard here. What we have here are two brain cells that are called neurons. And what generally happens is your presynaptic neuron releases a hormone called serotonin, that's these green dots here, into a space called a synapse between two brain cells. What happens next is that they are received by receptors on a postsynaptic neuron, which results in a mechanism that involves mood regulation. So what this study is saying is that people with genetic coding for more of these transporters here, which actually take serotonin out of this space here and bring it back into the presynaptic neuron, people with more of these transporters are less likely to develop depression. This is really conflicting with the fact that one of the medications that have been commonly found to help people with depression are serotonin reuptake inhibitors, which actually inhibit these transporters here and result in more serotonin in the synapse being received by the postsynaptic neuron. So it's very interesting to researchers that people with genetic coding for more of these transporters are found less likely to develop depression, while medications that block these transporters are found to help some but not all people that have depression. So basically what was concluded from this particular study was that there are a lot of unknown factors that are working together that determine whether or not an individual can develop depression, can or will develop depression. So research continues to be done to better understand how all of these different mechanisms are working together and how genetics and environment can play different parts in that. Another important thing that people want to understand is what effects can depression have on someone. As we saw in the case with Jimmy, the most immediately seen effects are things like sadness, hopelessness, loss of interest in things that someone used to love to do, loss of appetite, changes in sleep, sometimes suicidal thoughts as well. These things are very commonly seen in depression, but studies are also finding that there could be some long-term effects as well, even after someone has recovered from the disorder. An article published in the American Journal of Psychiatry called Hippocampal Volume Reduction in Major Depression showed that damage that occurs to the hippocampus from depression can have long-term effects. This particular study found that increased glucocorticoid levels and hippocampal atrophy resulting from depression increase risk of relapse in patients and can have certain long-term effects on brain function. The hippocampus is involved in learning and memory, and so it basically found that damage to this part of the brain might be resulting in impaired function in these areas with people that are having depression over a long period of time. So more research is also being done to understand what all is happening to people that are experiencing, especially like chronic depression. And a final question that is commonly asked is, how is depression best managed? Medication alone has been found to not be the best way to manage depression. A study published in the American Journal of Psychiatry found that patients who received cognitive behavioral therapy while overcoming depression were found to have a lower risk of relapse and less severe residual symptoms of their depression. Patients experiencing anxiety, for example, could be taught through therapy how to best cope and deal with their anxiety, whether it was limiting exposure or like managing feelings as they had them. And relative to patients that had depression and just checked in with their doctor every so often, it was found that these patients receiving therapy had a much better outcome overall. So, in conclusion, there are many things that are still not fully understood about this disorder, from how it's occurring, why, what implications it has on a physical level for these people. But a lot of research is being done to help people that are suffering from depression and to restore and maintain their quality of life.